And this country is very, very well prepared.
4 more cases were confirmed in the UK today, including 2 in Devon, where 5 schools have closed as a precaution. But the Health Secretary says others shouldn't need to.
Should we be shaking hands?
Shaking hands is okay, as long as you wash them often enough.
This afternoon, he told us that the government will pass an emergency law to stop the spread, but warned against too much urgency.
The single biggest thing that everybody can do is to wash your hands more often for 20 seconds whilst singing Happy Birthday twice and with soap and, if possible, hot water. But right now, the advice is not to cancel big events. We're not ruling out doing that later, similar with schools, unless there's a positive case of somebody in that school, whether teacher or pupil, and you have the advice from Public Health England, having taken that on board, then schools should not be closing.
How far away from some of those bigger measures do you think we are at this stage?
There's several weeks until this will become a very widespread in large numbers, even in the worst case scenario that we're looking at.
Can you guarantee that nobody will die from this virus because the NHS is under-resourced?
Well, as you know, I never make guarantees in healthcare because there are always risks that we've got to take into account. But of course, if you have a very big global health challenge like this, then it of course will have an impact on the NHS.
And you have emergency funding ready to go?
Well, this isn't really about the funding. As I say, there is record funding in the NHS right now and record staff in the NHS.
Are there any contingencies in terms of funding?
We've already made extra funding available to the NHS to deal specifically with things related to coronavirus, and I'm open to doing that any day of the week to make sure that we are as well prepared as possible.
But Labour warns that as the virus spreads, so too are the resources to deal with it. Paul Brandt, ITV News, Westminster.
Well, the coronavirus is continuing to spread right across the world. More than 89,000 people have now been infected and more than 3,000 have died. In the UK, we've seen cases almost double to 40 in the past 2 days. Yesterday, there were 12 new cases confirmed, including the first in Scotland. Today, it was announced that 4 more people have tested positive in Hertfordshire, Devon and Kent. All are believed to have visited Italy recently. Ivor Bennett is at Mount Vernon Cancer Centre in North West London, where one of those infected works as a clinician. But first, let's go to Martha Furley, who is at the ITV News offices in Maidstone. Now, an NHS worker who uses the same building there has tested positive for the virus. So, Martha, what precautions are they taking there?
Well, the man who is confirmed to have tested positive for coronavirus here worked for the NHS North East London Foundation Trust, which has an office in the building complex. And as a result, they are being treated for the virus while the rest of their team are taking the precautionary measure of self-isolating and working from home while their office will be deep cleaned. Now, there are 40 businesses here in the business park. Public Health England say they are contacting anyone who has been in close contact with the person affected. But one of the businesses is ITV Meridian's Maidstone Bureau, and although they are on a separate floor of the studio complex, ITV has sent staff home as a precautionary measure and says it will continue to monitor the situation.
OK, Martha, thank you. Let's go straight to Ivor now. So, Ivor, what is the situation for patients treated by the clinician who's tested positive for the virus?
Well, tonight the hospital has told us that everyone the clinician has come into contact here with has been identified and contacted, and that all necessary steps are being taken to manage this situation. The clinician we know tested positive for the virus over the weekend, and this case is of particular concern because the early research done into this virus has shown that cancer patients are among those to be at an increased risk of serious illness from the disease COVID-19. That being said, East and North Hertfordshire NHS Trust, which this centre is a part of, insists that the risk to patients and staff here remains low, and so the centre remains open tonight and patients are being told to attend appointments as normal and that it's safe for them to do so.
please. I can't hear. Ivor Bennett, thank you very much indeed. So let me tell you a little bit more about where I'm standing now, because this 111 call centre deals with urgent cases from right across the West Midlands. On any normal day, it's already very busy, but the past few days and weeks have seen the number of calls surge. In response, NHS England says it will recruit hundreds more staff. And our health correspondent Emily Morgan has been spending some time with some of the call handlers. So Emily, give us a picture of the sort of demand they're facing.
Well, it's unprecedented. I mean, all the call handlers that I've spoken to today here, there's around 100 here working at the moment, they all say that they've never seen anything like it, that it wasn't even the same as during the fears about Ebola 5 years ago. The number of calls that they're taking has increased by up to around 75%, which is massive. And they say that public really are concerned. So all the clinicians that are based down there, we've got some clinicians here, we've got call handlers over there, they all say that they are flat out, that their calls are backed up all the time. I think testament probably that the public are actually heeding advice and calling 111 if they are concerned. Well, I am with the Chief Executive of West Midlands Ambulance Trust. He is Anthony Marsh. Hello, Anthony. Are you coping with this?
The staff in this 111 call centre and indeed right across the country are doing a fantastic job, which is really testament to their professionalism, dedication to help all of our patients. But obviously we are busy, we're dealing with record numbers of calls to NHS 111, and we'd ask members of the public, wherever possible, to go online at 111.nhs.uk, where they can receive the latest up-to-date information to allow the staff in our call centres to be able to help patients and give them the right up-to-date clinical information where that's necessary.
Have you ever seen anything like this? Have you got enough staff to deal with these calls?
We have got enough staff. We are recruiting more staff. Additional funding has been made available for us to recruit more call handlers and more paramedics, more nurses, more doctors to work in these call centres. But above all, it would be really helpful if members of the public requiring up-to-date information would be able to go online. And of course, in the meantime, for all of us to regularly wash our hands for at least 20 seconds will help us to contain this virus and to protect the public.
Just quickly, finally, the National Service has been criticised for not passing on perhaps correct information, for giving confused information to the public. Do you regret that?
Well, certainly our staff are working flat out. The latest information is available in an evolving situation. So the information, the latest information does change on a day-to-day basis as we handle this incident. We'd encourage members of the public to go online, 111.nhs.uk for the very latest information.
Brilliant, thank you very much. Well, because of that demand, the government has announced new money to fund more members of staff for the 111 service, and a new online service has also been launched.
Emily, thank you very much indeed. Everyone here under immense pressure, as you can see. Now, the outbreak started in January, so what do we now know about the virus, its effects, and who is most at risk? Here's our science editor, Tom Clark.
This is how every sample of suspected coronavirus arrives at Public Health England's labs. As of today, they've received and tested 13,500 of them. But now the UK has seen its first domestic cases of the virus, they're only going to get busier.
We're tracing everybody we can in relation to the positive cases that we see on a day-to-day basis. It's still very important that we do that to try and reduce the risk of spread of infection as far as possible.
Here at Public Health England, they're getting very good at answering perhaps the most important question about coronavirus, which is, has somebody got it or not? But in order to bring this rapidly evolving outbreak under control, there are so many more questions we need answers to. What we do know is that coronavirus attacks and kills two specific types of cells in our lungs, called the goblet and ciliated cells. Both are vital to keep the lungs healthy. Losing them can lead to potentially lethal pneumonia. In some cases, the virus causes the immune system to go into overdrive, attacking the lungs themselves. The virus can also attack the kidneys and in some cases affect blood vessels and our circulation.
We do know that what's called supportive therapy is important. Supportive therapy basically is keeping people alive until they develop their own immunity and recover from the virus.
But what we don't yet know is which existing drugs, if any, could alleviate the worst symptoms, which vaccines being developed around the world will be most effective. Till then, protecting the most vulnerable is a high priority. According to data from China, no one under the age of 9 has died from coronavirus. The risk for young adults is also very low, with only 0.2% of cases among under 40s resulting in death. But the mortality rate rises significantly if you're over 50 and reaches almost 15% for anyone over 80. Watching out for symptoms, rapid testing and isolation can contain the disease. And right now it's the best weapon for protecting the minority of people at greatest risk from this dangerous virus. Tom Clark, ITV News.
Now, of course, the UK isn't the only European country dealing with the coronavirus outbreak. Italy has more cases than any other country outside Asia. There's been another sharp rise in infections there, and 52 people have now died. Authorities have locked down entire towns, closed public places, and restricted movement to try to contain the spread. And that is raising real fears about Italy's economy. Our Europe editor James Mates reports from Rome.
One of the world's great tourist destinations at a time of year when, certainly here at the Colosseum, they were anticipating the legions of visitors who throng to Rome each spring. Not this time. The handful who still walk the tourist trail here are nervous, taking precautions, and on the great stone terraces built for tens of thousands, almost alone. This is what happens to an economy when visitors stay home and locals worry about going outside. The city still functions, but in slow motion.
The Spanish steps almost empty, the Trevi fountain practically deserted, every business suffering, not just the tourist ones. And this in a city where the coronavirus has barely arrived. This could happen to any great European city.
You have to suspend a lot of activities. For example, in Italy, cinemas, theaters and so on are in a very big crisis.
And that will be the same in London and Paris and Berlin, just as it's been here in Rome.
Louvre, the Museum Louvre in Paris now is closed.
There are so far 12 confirmed cases in Rome, most now being treated at this hospital, where tents have been set up in the grounds outside in anticipation of many more. And it's that anticipation that is emptying St. Peter's Square and piazzas like it across the city. When the threat is invisible and its potential carriers unknown, many have decided simply to avoid any risk at all. Agnese Vulza says her restaurant could survive this for a month, not much more.
Everybody's worried. I had a lot of cancellation, also for groups. This week I had today and tomorrow 2 groups of like 20 people, and they can send everybody, all of them next week.
Italy has been a week or two ahead of the rest of Europe ever since it became the first Western country to suffer a mass coronavirus outbreak. But no one really doubts that what Italy and its economy are going through now will be the fate of others in Europe before too long. James Mates, ITV News, Rome.
In China, where the virus was first identified, although the number of cases does continue to rise, the rate of increase has slowed, leading to some hopes that the worst may be over. But millions of people remain in lockdown, and there is no sign that's about to change anytime soon. Our Asia correspondent Debbie Edward is in Beijing this evening. So, Debbie, is there any sense that the country might be at a turning point?
Well, that is certainly what the figures appear to suggest. Even compared to a few days ago, the 200 new cases and 36 deaths we saw overnight is regarded as low, and perhaps it is due to some optimism that this battle is being won, that we saw President Xi out in public for the first time in 3 weeks today here in Beijing. But there are 2 main reasons, apart from the politics of this country, that they've been able to turn this corner so relatively quickly, and that is manpower and technology. Not only were they able to send tens of thousands of medics to the epicenter in Wuhan, there are currently millions of volunteers and guards at offices, houses and shops, checking temperatures, checking ideas, monitoring the movements of every single person in this country. There's even now an app which will give people a green flag if they can go to work or enter the subway, or a red flag if they're deemed to be unwell. It's hard to see whether those extreme measures could be replicated in the UK or other countries to where the virus has now spread.
OK, Debbie Edward in Beijing, thank you. Well, here, the number of infections may be small by comparison, but efforts to contain its spread are still affecting many of us. Schools have closed, forcing parents to take time off, holiday plans have to be cancelled, and workers are unsure what to do should they get ill. Our consumer editor Chris Choi looks at the official advice and your rights.
Holiday plans are now a major concern for millions.
Can I get a refund on my flights?
Maria Laconte had booked for China.
The airline cancelled all the flights until the end of March, so I've been in touch with them. I'm hopefully going to get a refund. But then the slight kicker, I booked myself some tickets to Bologna, I'd say about a week before the first few cases of coronavirus started happening in northern Italy.
Many destinations are already affected. If yours is subject to a specific Foreign Office warning, you will usually get a refund. If it's not, you're unlikely to get your money back.
But there's got to be a line in the sand in this, and it is the Foreign Office advice. But be reassured that if the Foreign Office is concerned, they will change that advice, as they've already done about mainland China and 11 small towns in northern Italy.
Many concerts and events are also now in question. Samantha Brown's daughter has booked several this summer, both at home and overseas.
Going into an event where you have hundreds of kids mixing in a small arena for a whole weekend is a breeding ground for something like this.
The events haven't been cancelled. If they were, she'd be refunded, but no money back if she just changes her mind. But it's the workplace where many issues are emerging.
So what we try to offer is a classic.
Rowena Howie is determined to do the best for her workers in uncertain times.
Requests regarding time off, for instance, if schools had to close and staff members needed extra time off, 14-day self-isolations.
This employment lawyer says absence for self-isolation should be treated as sick leave and that firms must be sympathetic about other time off requests.
Employees are entitled to time off for dependents in emergency situations, so that would cover things like children being unable to attend school if their school was closed.
From thousands of miles away, it's becoming part of our daily lives, and much now depends on whether reliable information can pass as effectively as the virus itself. Chris Choi, ITV News.
Well, whether you're on holiday, you're at home or in the office, there are measures that you can take to minimise your chances of catching the virus. From washing your hands to not touching your face, here's our correspondent Rachel Younger on the right steps that you can take.
Children, have a little look at your hands. What's on your hands? What are we going to do about that then?
Wash them!
To make them nice and clean. Where should we go? To the tap!
They may be little, but what they're learning about here is the biggest weapon we have in the fight against coronavirus.
This is the way we wash our hands.
Washing our hands regularly is a mantra every medical professional keeps repeating because they need us to keep doing it. We may be emptying the shelves of hand sanitizer, but it needs to be an extra, not a substitute.
If there's no facilities for hand washing, well then antiviral foams and hand sanitizers do have a role to play, but they don't take the place of appropriate hand washing.
There's no suggestion public transport should be avoided, although the NHS, perhaps optimistically, suggests keeping a metre away from anyone who looks unwell.
Rather easier to follow is the instruction always to cough or sneeze into a disposable tissue or into the crook of your arm if you don't have one, and then to put those used tissues straight into the bin.
The NHS is rolling out ways of testing people who suspect they may have the virus, including this West London drive-through. And while early symptoms like a fever and a cough aren't critical, how you react is.
I'd really politely ask you not to go through the door of your GP practice if you think you may have been exposed to COVID or have the symptoms of COVID. Please pick up the telephone and dial 111.
They may tell you to self-isolate, but how do you start?
If you are asked to stay at home, the advice from the NHS is not to be in the same room at the same time as anyone else. If, like most homes, there's only one bathroom, then the person with the symptoms should clean it thoroughly after use, and things like towels, cutlery and utensils shouldn't be shared.
When it comes to containing the spread of the virus, it may feel like there are still far more questions than answers. But what happens next will depend to a degree on all of us. Rachel Younger, ITV News.
If you follow that advice, hopefully you can avoid infection. And just an update, whilst we've been on air, Public Health England says that the second test on the clinician at Mount Vernon Cancer Centre shows the patient does not have the virus, which is obviously good news. Well, that's all from our special programme tonight, but it's not the end of our coverage. If you have any questions about the coronavirus, our panel of correspondents will be answering them in a live Q&A straight after this programme. So to ask your question and to watch the Q&A, head over to itv.com/news. And that's all from us in the West Midlands. Julie's here with the latest on News at 10, but from me and all the team here in Dudley and everyone in this studio, have a very good evening. Bye-bye. You're first as well, Chris. Hello, I'm Lucrezia. This is a live Q&A from ITV News on the coronavirus outbreak. We're streaming live on itv.com/news, Facebook, Twitter and YouTube. On the day, the Prime Minister said the spread of the coronavirus was likely to become more significant in the coming days. We'll be answering your questions on the virus with the help of our team of ITV News correspondents. Now, to ask your question, post it in the comments or email your story at itn.co.uk. Answering your questions will be our science editor, Tom Clark, and our consumer editor, Chris Choi. But first, an update on what is happening with the coronavirus in the UK and around the world. Globally, there have been nearly 90,000 cases of coronavirus with more than 3,000 deaths. There have been 4 new cases of the virus in England today, bringing the total to 40 in the UK. Boris Johnson has warned that the spread of coronavirus is likely to become more significant across the UK, adding that ministers have agreed to a plan to contain the spread of the disease. Okay, let's get to some of the questions that you've been sending us in today. And Chris, we're going to start with you. Unsurprisingly, we've had lots of questions about travel. A lot of people worried. This is from Diane. I have tickets to fly to Sicily and Milan at the end of March and Easter, and I don't know what to do. As it's not banned to fly to Italy, I won't get a refund if I cancel, and yet we're being told if we come back from Italy, self-isolate, even if we have no symptoms. Can anyone tell us if we actually get the money back if we are cancelling our flights, or should we just travel and come back and self-isolate, hoping for the best? Lots of questions in there, really.
Yeah,
Yes.
I mean, and remember, holidays are meant to be a kind of joyful thing. We're thinking and looking forward to them. Now the virus has made it a worry for many people. First of all, it all comes down to something that is pretty solid information, and that's the government's own website, the Foreign and Commonwealth Office. They issue a list of destinations that we shouldn't be travelling to. Now, if your destination is specifically on that list, then you mustn't travel, and as a consequence of that, you will be able to cancel, you'll get full refunds. Now, there's a vaguer, greyer zone. Places like Italy would fall into that category where people generally feel uneasy. But if you look at that website, and I encourage anybody who's planning a trip to do so, have a look at that Foreign Office website. You'll see that there are only around about 11 relatively obscure Italian towns that are currently on that list for no travel. So that means if you decide not to go, well, within the terminology of the travel trade, that is called disinclination to travel. In other words, it's your choice not to go.
Yeah.
Perhaps very understandable, of course, because people do feel nervy, but don't expect to get a refund or from insurance policies, because they'll all be now looking at that Foreign Office website. On this other matter of self-isolation, again, a lot depends on that Foreign and Commonwealth Office site, because if on that site it is an area where we're not meant to be travelling, those areas of China, for example, some parts of South Korea, and you come back even without symptoms, you should be self-isolating. But for most of the rest, it is only a matter of going into self-quarantine if you feel some of those symptoms. It is complicated, and I apologise for it, but it is all there in black and white on the official website, and I think they're getting an incredible flow of traffic today because there's a lot of disinformation out there. Go back to the actual official source there, it's right there online.
Really good advice there. And just to ask you, we've heard some airlines cancelling flights, particularly to Italy. I think EasyJet did last week, didn't they? Now, we've heard also that BA and Ryanair are cancelling a lot of flights to Europe and the US.
Yeah, we've had more cancellations this afternoon, as you say, Ryanair and BA flights. This is going to happen more and more. What we're seeing is quite a number of pretty large events around the world being cancelled. And as soon as airlines sense seats are going to be empty, they'll start cancelling flights and consolidating them. That's their cancellation, so you're going to get a refund. Where it becomes more tricky is the consequent costs. So, for example, you've got a hire car or a hotel booked, and perhaps that is jeopardised by you taking a different flight. If you do incur those kinds of costs, keep a very careful note of them and then go back to the airline and say, this is your fault, it's you that cancelled the flight.
Oh, goodness me, good advice again, Tom. Oh, let's go to you now. This is a question from Ross Frampton. Why do Public Health England keep giving advice to wash hands while ignoring the fact that this is a respiratory disease and people can breathe it in. Therefore, being in large crowds increases the risk of spreading the virus.
It's a really reasonable question, and one I think that there's a lot of people are asking. Yes, it's in your chest, it's being breathed. We're being told to catch our sneezes and coughs in a tissue and bin it the best way across it. So why washing our hands? I think it comes down to what we're learning about the dynamics of this virus compared to things like flu. Flu spreads much more readily than coronavirus does, actually, in that kind of airborne environment. From what we're seeing, based on lots and tens of thousands of cases they've been followed up in China, it looks like you have to be fairly close to people for a degree of time before the virus is spread. It's not spreading very rapidly on airplanes, in trains, on the subway network. If it was, it would have been a very different dynamic to this outbreak. So the leading theory is it's being passed on by, yes, coughs and sneezes, but onto surfaces or onto hands, which are then touched, lift buttons, doorknobs, handrails. If you keep washing your hands, you're doing a great deal towards minimising contact with the virus. You're probably not going to pick it up walking down the street alongside other people. It takes quite a bit more proximity and long term. A lot of it's spreading, it seems, in family clusters in China. You have close proximity to a loved one or a relative who's had it or a visitor. You have to have quite close contact with them to pick it up.
So still wash the hands, it just anything you can do to minimise the risk, basically.
Absolutely, but sort of avoiding public spaces or there's not great evidence, and this is something actually we're looking at the moment. I mean, maybe I'm preempting another question here, but a lot of people are concerned about big public events, like sporting events. Certainly, when you're trying to contain an outbreak, when there's still a chance of keeping a lid on it, it might be sensible to limit some of those big public gatherings. But maybe this is a bit of a sad one. Look at once the virus is here and is spreading fairly freely, there is very good evidence it does not really do much to slow spread of viruses, banning football matches. What it can actually do is sort of affect people's morale and do very little about the virus. They're going to pick up anyway, going to work,
Because we have seen that in Italy, haven't we? They've closed football matches, France, no big gatherings.
Because they're still in that
5,000.
containment phase. It's that effort to see, can we try and really keep a lid on it? But there is limited evidence of how effective it is. But I think right now, when there's still so much to really play for in terms of seeing if you can actually contain it, it might be justified. But as we go forward, I think maybe we have become a bit more relaxed about those things.
Very quickly, because you did touch on it just a second ago, but Lynn wants to know, can anyone explain the dangers of travelling on a train? I commute to Manchester every day and it's a very crowded train. I know lots of people in London travel on the tube. There are concerns there.
Of course, I think all of us are maybe just giving that, coughs and sneezes are catching our attention a little bit more. All I would say is it's clearly not been spreading that rapidly through that kind of airborne route. If you're right next to someone who's coughing and sneezing and not catching that in a tissue or in their hand, I would probably give them a bit of distance at the moment. But the good advice, again, is to wash your hands. If you feel cold and flu yourself, make sure you're catching it and killing it. That's the best thing to do.
Wash your hands. You can't say that too many times, can you? Chris, another one from you. Now, this is from Nikki. I'm self-employed and could not self-isolate without losing my income. Therefore, I can't pay my bills without any money. How would I even manage?
Well, it's difficult, isn't it? First of all, make sure that you're self-isolating appropriately. There's a lot of talk about people needing to self-isolate when they actually don't. But obviously, if you have to take time off work, then your employer, if you have one, not in this case for Nikki, but if you do have an employer, they at the moment, as the first kind of tranche of information, are being urged to take a generous view of things. I was speaking to an employment lawyer this afternoon who said this isn't even a grey area, actually, that the employers have a general responsibility to their workforce to encourage them to self-isolate and therefore to view this as sick leave, because of course, interestingly, you're not sick, but they're urging, ACAS is urging, the government is urging, lawyers are urging employers to see that very much as sick. Now, if you're self-employed, that's far different, of course. Let's hope that some self-employed people have insurance policies for this kind of risk or savings. There are big problems when it comes to statutory sick pay because there's a 3-day wait for that. Some people don't qualify at all. If things do get worse, there's already some sign that there will be pressure building for government to intervene and to make some kind of provision, because the last thing we want is anybody, whether self-employed, gig economy or employed going into workplaces if they feel unwell in these circumstances when we're trying to get containment to be effective.
Yeah, because they just don't want to lose money. Tom, another one from you. This is from Harris. Interesting. Why is the coronavirus so unique?
It's a really good question. It actually gets to the heart of why we're so concerned about it. Yeah. It's totally new. We've never seen this type of virus before. Interesting, going back to what Chris said, the common cold is caused by coronavirus. So we're used to what a coronavirus is. In fact, of the 350,000 samples they've tested at Public Health England's labs, the vast majority, only 40 are positive. The rest tend to be ordinary cold virus. It's a coldy time of year. There's a lot of it going around. Coronavirus is unique. It's totally new. Our immune system has never seen it before. That is probably why we're seeing this very weird profile for this virus. For the vast majority of people, it causes not more than a bad cold or sort of flu-like symptoms. But not to be confused, it is not the flu. It is a very different bug indeed. And for people who get severe illness, about 20% of them, it's really very nasty indeed. It's giving a profile of illness that's not really that similar to flu. It's causing organ, sort of kidney problems with circulation. One of the biggest risk factors, interestingly, is coronary disease, not respiratory disease. It's a bit of a mystery, and it's unique because, yes, it is new. It's just jumped out of an animal host. We don't quite know what that is yet. It's probably, at some point, it's got a bat ancestor and it's been in some other kind of animal. But we know from the genetics, it only just jumped into humans last year, end of 2019. It really is a new virus.
We looked at the virus, obviously we've seen the most cases in China. I mean, who are people who are most at risk from becoming really ill because of this virus?
We're fortunate now in that the Chinese authorities and the World Health Organization have worked very closely together to really look at about 60,000 cases in China, to look at that profile. Very interestingly, under 9 years old, there's been no fatalities from the coronavirus. Kids can get infected, some of them have become fairly ill, but none of them have died. Then up till about the age of 40, very low risk of dying, less than 0.5% risk of dying if you're under 40. But then from 50 and above, the risk basically increases in a straight line as you get closer to 80. And in the elderly, the risk of death is about 15%, which for a virus is really very high indeed, very worryingly high. The positive side of that, because the vast majority of people aren't going to be that ill, or they might be off sick for a while, it does give us some hope of containing, or at least putting barriers up to protect those people who are most at risk from the virus. So what I mean, if you know who your at-risk groups are, to protect them. Obviously, people with pre-existing conditions also fit into a more vulnerable category. But again, the younger you are, the less likely that is to be a problem as well, it seems, from the data from China.
Okay, just say, anyone got any more questions, please get in touch with us on all our platforms. But Chris, I want to go back to that large gatherings, those events, those crowds. I mean, what if you've got, I don't know, concert tickets coming up in the next month or so? We don't know if we're going to contain the outbreak here or not.
No.
What about, do we get any money back for those tickets if we decide not to go?
Good question, and again, it depends on the detail. This afternoon we were talking to a mum whose daughter has booked several of these types of events at home and overseas this summer. Now, at the moment, none have actually been